My name is Schmock and I'm the administrator.
My name is Holly Hammer. I'm a director of nursing.
So we are a drug and alcohol rehabilitation center. We offer 4 levels of care. We offer detox, residential care, partial hospitalization, and intensive outpatient hospitalization.
The most common thing that we're seeing right now is, of course, a problem with opioids. So opioid substance use disorders are very common right now. As most people know, there's an opioid crisis that has been raging across the country the last few years. What people may not know or may be surprised to know is that for the first time in my career, we are really starting to see more cross addictions than we have seen in previous years. So what I mean when I say a cross addiction is a client who may have an addiction to 2 or more substances. So it could be alcohol and opioids, or cocaine and alcohol, or any combination thereof. So I think when we think about fentanyl, we kind of think of it as a city problem or a metropolitan area problem. But the truth of the matter is that fentanyl is affecting our neighbors, our friends, our family members right here in Mansfield. People may be interested to know that Tarrant County has had significant increases from 2019 through 2021 of overdose mortalities. A lot of those overdose mortalities are connected or related to fentanyl. If we want to talk about fentanyl specifically, there were 143 fentanyl overdoses in Tarrant County in 2021 alone. So this is very much a problem that's affecting us right here at home.
So I think most of that data is still preliminary, and that's why we haven't seen a lot of it out. But when you look at the stat and go on the state website, you see a drastic increase from 2019, 2020, 2021. So we can only assume with everything that we're hearing and everything that we're seeing that it's going to continue to increase when the data comes out for 2022 and 2023. And you know, kind of like Holly was saying, the scary thing with fentanyl is that it's everywhere. I mean, it can be put in candy, it can be put in a Xanax pill that you think that you're taking, and so nothing is safe if you're buying it off of the street, if it's not a prescription, if it's not taken how it's supposed to. And I think that that's kind of the scary thing that we're seeing with fentanyl. There's the campaign going that one pill kills, and that is truly the scary thing.
And you know, with that, to give you some more numbers, because if you're a data person like I am, I want to know, well, what does this really mean? Give me some facts. There were 17,000 overdose related emergency department visits from Tarrant County residents from 2019 to 2022. So when you think about that, of the 143 fentanyl deaths, there were 17,000 ER visits. So although a lot of people were able to be saved, that really speaks to the volume of this problem that we're seeing. The root of most addictions is trauma, right? There's trauma that's happened, there's trauma that's happening. And that's why it's so important to get treatment from professionals, because until that trauma can be dealt with, processed, the symptoms are going to remain. The anxiety, the depression, racing thoughts, inability to sleep, irritability, feeling triggered by things. We've got to deal with what's going on underneath that if we really want to get to the root of the issue.
And I think speaking to that with trauma is different for everyone, right? And so it could be you got into a car accident and that was a big trauma for you, and that triggers you and that causes you to use substance. It could be a sexual assault. It could be breaking up in a relationship. And so trauma is different for everyone, which is pretty widespread. And I think when people hear trauma, they think of some huge event that is catastrophic that happened, and that's not always the case for each and every person.
And even events that we have wanted. So a divorce, maybe you wanted a divorce or you needed one, that can still be a trauma for you. So even if it's something that was a positive in your life, that doesn't mean that it can't have some trauma roots in there. So when we're talking about profiles of individuals using substance use disorders, in the past, I think that people have thought it's a homeless population problem, or it's a man problem. But what we're actually seeing and what the data shows is that that's not true at all. People in the healthcare profession, I'm talking about pharmacists, EMS personnel, nurses, doctors, are at a more increased risk than ever of developing a substance use disorder. In addition to that, it used to be that alcohol was a man problem, but the data from the CDC actually shows that women's mortality rate due to alcohol use is rising exponentially faster and higher than those of men. The average, what we're seeing is that young and middle-aged women on average are having a pretty high increase in their alcohol use and alcohol use disorders, and that's really new considering the past history of substance use disorders.
And in Tarrant County and Dallas County, what we're seeing is that it's middle-aged white males are at the highest risk, and I want to say it's between the ages of 18 and 40. It's either 40 or 44, but right in that middle-aged area. So that is the highest risk area.
And teenagers are not exempt, right? And so this is something we have to talk about because it's affecting us across the lifespan. It's affecting us as we're young, as we're growing, and as we age. One thing to know regarding teenagers and substance use disorders is that they are more likely to binge drink. Binge drinking really is just defined as drinking 3 or more drinks on one occasion, and it's typically sporadic. So you'll have somebody who binge drinks on the weekends, and then they don't drink during the week. And it's easy to think, well, I don't have a problem because I don't drink during the week, or I don't drink when I'm going to work. But if you're binge drinking on the weekends to the point that you pass out, or to the point that you can't remember what happened, that may be an indication that there may be more going on that you need to look into. A good rule of thumb is to consider that anytime you're uncomfortable with the way you're using substances, or how or why you're using substances, that's a good indication that you may need to talk to somebody more about that. It is important to know that 17% of Tarrant County residents aged 18 to 20 report binge drinking frequently. They report that they are underage, they recognize they're underage, but that doesn't stop the activity. The bright spot of news in that is that teenagers are less likely to drink, smoke, or use illicit substances if their parents are keeping tabs on their activities, and that's according to some studies that we reviewed.
I think that's a great one. I mean, I think a loss of interest in things that people used to do, if they're acting out of character or sporadic, if they are sleeping more than normal, or maybe not sleeping at all, I think all of those are indications.
Definitely all of those. Changes in appetite. I'm not eating, or I'm eating a lot more than I usually do. I complain of headaches a lot, stomach pain. I seem more anxious than I normally am. I'm irritable or agitated when that's not my baseline, or that's not my norm. It could be that they're difficult to wake up, difficult to have a conversation with. They seem spaced out, or they seem like they're not really there or engaged in the conversation, or they have memory lapses. So they did something, said something they don't remember, or they say they didn't do, but you know that they did. It's a good indication that we need to dig a little deeper.
Yeah, I mean, I think that that's a good indication. I think that we talk about trauma, but we also, didn't really reach on the anxiety, the depression, and a lot of people, when they don't like the way that they feel, use a substance to cope with that. And so you're right. I mean, it is a lack of coping skills for a lot of the things that we see. That's not always the case, but that is probably one of the highest things that we do see.
I think another thing to be aware of is that people tend to emulate what they see. So if there's a history of substance use disorder in the family, or in those that were around frequently, we need to take a deeper dive there, because when people learn that this is an okay way to deal with how I'm feeling, or to escape the situation or how I'm feeling, they tend to go to what they know. I think another important piece of it is that if you know that your child, your loved one, your friend, whatever it may be, if you know that they've gone through something that may be a trauma trigger for them, getting them the help proactively instead of reactively will go a long, long way. If you're kid struggles at school, they struggle with being bullied, they struggle with any number of things. Getting them professional help early is so much better than having to do it after an event has happened. So treatment is so wide and varied. It depends on each individual and each individual situation. In the substance use disorder world, there is what we refer to as MAT, which is medication assisted treatment. And that really just speaks to using medications to help you with the withdrawal, the detox period of things, and then using medication to help reduce the event that you will relapse, or if you do relapse, to reduce the fatality risk of that relapse. Therapy is also a very big component, and adjunctive therapy is an important piece of things. So learning new coping skills, learning new ways to deal with the anxiety, the depression, social anxiety that we have are all very, very important. And it all works together. No one treatment alone it's hard to say that any one treatment alone would be effective in managing or treating a substance use disorder.
So for me, I would say that it is not, it's everybody. And so we see CEOs here, we see nurses, we see doctors, we see just everyone here. And so thinking that it's not going to happen to you, it's not going to happen to anybody in your life, it's not going to happen to any of your loved ones, is not realistic. And so being ready to take that step to be able to help them, know how to help them. We always plug to carry Narcan, because if somebody does have an opioid overdose, that's life-saving. And you can buy it at Walgreens, CVS, any pharmacy basically. It's over the counter now, which is awesome, but making sure you're carrying that, because you could save somebody's life, and it could be somebody that you least expect.
And I will say, one thing that I hear is, well, what if I use it and it's not an overdose? You're very, very unlikely to injure anyone. If you use Narcan and it's not an overdose, you're not going to harm them. The real risk is not using it because you aren't sure. It's better to use it than not. For me, what I want to say is that overdoses kill up to 5 Texans every day. So multiply that by 365 days a year. We already know that Tarrant County is in the middle of struggling with this, as is most of the country. This is very likely going to affect you, someone that you know, someone that you care about, your employee, your employer. So it's really important to get information, stay aware. It is a scary thing that we're going through, but the good news is that you don't have to go through it alone. There are resources, there is help available for you, your friends, your loved ones. You just have to be courageous enough to access the help.